Dr. Tomeo, thank you for joining us here on MD Newsline. Would you please introduce yourself to our audience?
So my name is Michael Tomeo. I'm a board certified dermatologist. I've been practicing for many years. I've had a clinical practice for many years. I'm actually now doing some research. And interestingly, one of the projects that we're working on has to do with chronic urticaria.
Wow, yeah, and that's what we're here to talk about, chronic hives, urticaria, as you called it. Could you start by giving us just a brief definition of chronic urticaria and how it differs from other forms of urticaria?
So chronic urticaria by definition is hives, usually on a daily basis, that last at least 6 weeks. So if you're experiencing hives on a daily basis or very frequently, and that period of time has exceeded 6 weeks, we consider that chronic urticaria.
And from a clinical perspective, how common is chronic urticaria in practice, and are we seeing changes in incidence or patient demographics?
Um, Not necessarily in demographics. It seems like the highest incidence is in Asians for some reason, interestingly. But I would say the incidence is it affects about 1% of the population. So that, in America, we're talking about 3 million people essentially. It comes and goes, and the population do change in terms of who gets affected. But generally, it's also a female predominant disease, probably 70 to 30 in that ratio, 70 to 30.
Interestingly enough, we always have this conversation about how females are more affected by autoimmune
Correct.
things.
That's right.
And this is something that has autoimmune implications, obviously. So, what are some of the current insights into immunologic or non immunologic mechanisms driving urticaria?
Well, when we talk about urticaria, we can also divide it into what's called chronic spontaneous urticaria, which is CSU, and that composes a lot of the urticaria that we see in our office. And that can be fractionated in two ways also. There's an autoallergy form, which is IgE driven, and there's the other form, which is more immunologic or autoimmune, and that's driven by IgG.
Mhm.
So those are really the two main forms that we see in CSU.
So let's talk a little bit about what that means for an average person. When you say chronic spontaneous
Right.
versus chronic, like what does an average patient, how do they experience that in their body and what's driving it for them?
Well, they don't know what's causing it, and oftentimes we can't really define what's causing it. We know there's an immune mechanism at work, but we don't know what triggers it, so to speak. So we try to determine what's causing the urticaria. If it's acute, oftentimes that does resolve on its own. But if it's a chronic urticaria, there's probably some sort of immune dysfunction that's resulting in the urticaria. So what we do is we do some testing, but most importantly, we do a history and we try to determine if there's been any exposures or if there's been any changes in patient's medical situation. But we can do some testing to determine maybe to fractionate which type of urticaria it is.
Mhm. So when you say spontaneous or chronic spontaneous, those words seem to go against each other, right? So what does that mean? How do patients experience the chronic spontaneous combination?
Well, we actually used to call it a chronic idiopathic urticaria. Maybe that's a better term because oftentimes we don't know what the cause is. Even though we understand the immunology, so to speak, we don't know what the trigger is and we don't know why people are developing it spontaneously.
Gotcha. So, can you describe the role of autoimmunity, specifically IgG autoantibodies
Mhm.
against FC receptors in the
Yes.
pathogenesis?
When we talk about urticaria, the main cell that we're talking about is the mast cell. So the mast cell has an FC receptor, as do other cells. But when that FC receptor is stimulated by IgE, for instance, or IgG, the end result is it releases vasoactive materials such as histamine. And that's what causes the start of the inflammatory process, the immune process.